I am working on legislation which is not inconsistent with what Trump has talked about, and that is we should not be paying higher prices for prescription drugs.
We see a tense and revealing exchange between Bernie Sanders and Robert F. Kennedy Jr. during a hearing on Donald Trump's proposed 2027 budget, and it highlights a deeper clash over the future of public health policy in the United States.
Secretary Kennedy, how are you? You know, in public life, we all make misstatements, all right? A couple of hours ago, I think you said to Senator Wyden that we now pay the lowest prices in the world for prescription drugs. That is an absurd statement. Nobody in the world believes that. Do you want to correct that statement?
It's for the drugs that are on Trump RX.
I'm not talking about drugs. You said we pay the lowest prices in the world for prescription drugs.
For those drugs, we do.
I'm sorry?
For those drugs, we do, Senator.
Well, for certain drugs, but in general, would you agree with the RAND Corporation and every other independent survey that we continue to pay the highest prices in the world? In many, you agree with that?
Many drugs are not covered by the agreements yet.
On average, do we pay the highest prices in the world?
As we always have, except for the most common
I'm not
drugs.
saying this is a new development, but you said a moment ago that we pay the lowest prices in the world.
The most common drugs, we do. Or GLPs, or IVF drugs, or COPD drugs, or asthma drugs, for insulin.
Well, let me give you an example. For the cancer drug Opdivo, it costs $260,000 in the United States, costs $56,000 in Japan. We pay on the lowest prices, et cetera, et cetera. Senator Welch made the same point. All right, the bottom line is, look, there are thousands of drugs out there. There may be a drug here or a drug there. We pay lower prices. In general, according to the RAND Corporation, we now pay nearly 3 times as much for prescription drugs than 33 other countries in the OECD. You agree with that?
And for the most common drugs, we have the lowest prices.
All right. I am working on legislation which is not inconsistent with what Trump has talked about, and that is we should not be paying higher prices for prescription drugs than people in Europe or in Canada. Is that a concept that you can support?
Yes, President Trump wants this codified, and you have a lot more power than we do.
You're right. You're exactly right, and that is why I am going to be offering an amendment to the budget process right now, which would in fact codify what Trump is talking about, that the United States should not be paying higher prices than other countries around the world. Is that an amendment that you can support and get Republicans to come on board?
We will work with you, but in theory, that's exactly what we want.
All right, let me ask you another question. We're on the Help Committee. Casey Means, who is the Trump nominee for Surgeon General, was before us a while back. She agreed with me that TV ads, prescription drug TV ads in America should be banned. As you may know, we're one of 2 countries in the world. Do you agree with that?
Yes, I agree with it in theory. Constitutionally, you can't ban it, but we are now regulating it for the first time, and you'll see that the ads have changed on TV recently because we've sent out 1,000 disciplinary letters.
You may be right, but I think, you know, the people who determine the constitutionality of laws are the Supreme Court.
Well, we worked a lot on it because I wanted to regulate it.
Okay, but bottom line is, am I hearing you correctly to say that you would like to see a ban on prescription drug TV ads?
Yes.
Okay, good. There are a lot of seniors in this country who right now cannot afford dental care. Many seniors have no teeth in their mouths, can't afford hearing aids. I am introducing an amendment to the budget process which would expand Medicare to cover dental, hearing, and vision. Is that something you can support?
I'm happy to talk to you about it. I'm happy to work with you on it.
Other question. Right now, we have a diabetes epidemic in this country, an obesity epidemic. Many parents who would like to buy healthy food for their kids really can't make sense of the labeling on food products. All right? Other countries in the world are quite clear in their labeling about the amount of sugar, et cetera, that's in a product. Are you guys making any progress in coming up with simple, strong labeling on food products?
Yes, we are.
When will we see something?
Well, the delay in it has been that one of the big enemies, as you point out, obesity is costing 80% of Medicaid and Medicare dollars. One of the big problems is ultra-processed food, and there has been no federal definition or any usable definition. We've now worked out a definition. There are other, and here at HHS, we're in the process of going through the interagency process. There's other agencies that are Equity, USDA, Department of Commerce, OMB, and they are reviewing our regulations. As soon as we promulgate those, we already have the labeling ready to go.
Do you have any sense when that will be?
Excuse me?
Any sense when that you'll be promulgating that?
It has to go, Senator, through the other agencies that I don't have any control, but we want it to happen quickly.
Yeah, thank you.
Mr. Chairman, before he leaves, let me agree with Senator Sanders and ask unanimous consent that an article in the New York Times which shows that there's a higher price for Wegovy on Trump RX. This is the fact in terms of America, and Senator Sanders has been correct.
Without objection.
Sanders comes into this hearing with a very clear agenda: accountability. His line of questioning isn't just about numbers on a spreadsheet, it's about priorities. Who benefits from this budget? Who gets left behind? And more importantly, what happens to ordinary Americans if key health programs are cut or reshaped? On the other side, RFK Jr. finds himself in a complicated position. As health secretary, he's tasked with defending the administration's proposals, but he's also navigating skepticism, not just from political opponents like Sanders, but from a broader public that's closely watching how health policy is being handled. His responses in this exchange matter because they signal how aggressively the administration plans to pursue changes in healthcare funding, research, and access. What makes this moment especially significant is the ideological divide on display. Sanders represents a long-standing push for expanded public health care, stronger safety nets, and increased government responsibility in protecting citizens' well-being. In contrast, the Trump administration's budget approach often emphasizes spending cuts, restructuring, and shifting responsibilities, sometimes toward private sectors or state-level control. As Sanders presses RFK Jr., you can sense the underlying tension. This isn't just oversight, it's a warning. Sanders is effectively saying that budget decisions are moral decisions. Cutting funding to health programs isn't abstract. It has real consequences for real people. At the same time, RFK Jr.'s responses are carefully measured. He's balancing defense of the administration with the need to appear credible and responsive under scrutiny. Whether he succeeds or not depends on how viewers interpret his answers. Are they reassuring, or do they raise more questions? Ultimately, this exchange is a snapshot of a larger battle over the direction of U.S. healthcare policy. It's about trust in institutions, the role of government, and competing visions for how to care for a nation's population. And moments like this matter, because hearings aren't just political theater, they shape public perception, influence policy outcomes, and signal what's coming next.